Hello, I'm Stephen Stack, Commissioner for Public Health in the Commonwealth of Kentucky. I'm here with you today to review where we've gone with the coronavirus in the state of Kentucky from March until present times. I'm going to use some slides today to make these points. The first slide I'm going to show you compares New York back in the earlier days of the pandemic with where we are today in Kentucky. You can see a huge spike in New York. The disease hit them very hard, particularly in New York City. They had a marked surge of patients. It overwhelmed the hospitals. It required them even to create field hospitals in the middle of Central Park in New York City. In Kentucky, however, after an increase at the beginning, we've been able to sustain a flattened curve for the entire 4 months of this pandemic. The University of Kentucky, at their College of Business, undertook a research study to look and see what impact healthy at-home interventions had in the state of Kentucky. And they were able to demonstrate very compellingly that the interventions we took as a state by staying at home and staying healthy at home helped us to flatten the curve and save lives and minimize the impact from a public health standpoint of this disease on the people of Kentucky. What we're seeing now, however, is other states who did initially take some measures have lifted their social distancing interventions. Some have done so much more quickly than others. Here we show Arizona and again compare it with Kentucky. Arizona is having a severe spike of disease at present that now threatens to overrun their hospitals and cause an increased loss of human life. In Kentucky, however, because we transitioned successfully from healthy at home to healthy at work in a progressive and gradual manner, we have been able to keep our epidemic curve flat and stable over these last few months. Here I'm going to compare Florida with Kentucky, and I'm going to use two different metrics. Florida lifted their measures beginning in May. They did so a bit more aggressively than we've done here in Kentucky, and what you see is their test positivity rate surged and is now in the double digits. By comparison, if you look at Kentucky, once we got testing more widespread and we got the disease under control, we have been able to keep our test positivity rate in the range of 2 to 5%. On this slide, it's shown at a little over 3%. And then this is another way of showing how rapidly the disease is spreading between people. In Florida, they have a rate that's over 1.3, whereas in Kentucky, our rate is just barely over 1. We have managed to hover slightly above or below 1 over the last couple months. That means the disease is just holding its own or continuing at a very slow burn rate in comparison to a state like Florida, which is having a marked escalation of the disease. This, I think, at the present time is the best we can hope to achieve, keeping a slow and controlled burn rate for the disease because, as I think you all know, we have no vaccine to prevent the disease. We have no cure to eliminate the disease, and we have no disease-specific treatment that can neutralize the threat of the disease if you get it and if you should be one of the patients who are particularly hard hit by the disease. On this slide, which is the last one I'll show you today, I use another website that uses a different methodology to determine, are you red, meaning in obvious danger because the disease is escalating and you're running out of resources to treat people with a serious infection? Are you yellow, which means you're obviously like a stoplight, cautionary, but perhaps making some progress? Or green, are you in good shape? Now, I did this image yesterday on July 6th, and today on July 7th, we've already flipped from a yellow to a red. The colors do change from day to day, but what is most alarming is that this nationwide map is overwhelmingly red and has progressively become more red in recent months. So Team Kentucky, the measures we have to keep ourselves safe are the same as we started back in March. It's social distancing, staying more than 6 feet away from each other. Universal masking, whenever you come closer than 6 feet, you must wear a mask to keep yourself from spreading infection to others, and in a lesser extent, perhaps to help you reduce the risk of getting infected by them. You also have to use proper hand hygiene, washing your hands or using hand sanitizer frequently. And the fourth and the final element is screening yourself daily for fever and for signs of infection. And if you have those, staying home. Do not go to work. Do not go to school. Don't go out and socialize. Stay home to isolate yourselves and get tested for COVID-19 so you can know if you have the disease and take additional steps to protect yourself and those you love. Team Kentucky, we've done a great job over the last 4 months. I know there have been difficult sacrifices, but we have very clearly flattened the curve for a full 4 months into this disease. It is surging, though, in other states, and we would be naive to think that the disease is going to respect state borders. If we don't take the steps to socially distance, wear masks, wash our hands, and to screen for disease and get tested, we will have a resurgence in the state of Kentucky, and that will bring about harms all of us have worked too hard to prevent and none of us want to see. Thank you for all the great work you have done in the past 4 months. The hard work is not over. I know we all want it to go away, but I'm going to need you to keep working hard in the months ahead until we can get a vaccine, a cure, or a treatment. And at that day, then hopefully we can finally put COVID-19 behind us. Thank you, Team Kentucky. Together, we can prevail over the coronavirus.